This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo! Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And this month only, take advantage of this special offer. You can get 50% off Vetrimax Allergy Season Chews through Chewy.com. Enter promo code Allergy50 at checkout. Vetrimax Allergy Season. Start it before it starts. Place your order now for this 50% off deal. Go to Chewy.com and enter the promo code Allergy50. Hey Janet, we have been getting so many questions from viewers about poop, about vomiting, about diarrhea. We've got vomiting cats all over. We've got diarrhea in the house. So you know our expert, our GI expert, Dr. Adam Rudinsky, and I don't even know that we're going to be able to get all these questions in. So welcome, Dr. Rudinsky. We're so glad to have you today. And I know Janet's going to start with a question.
Well, I'm just so excited. Of course, it's our pleasure, especially a fellow Buckeye. I just, all my friends are always saying, can you ask your sister, my dog had grass in their poop.
And I just do skin.
Pictures of poop, like across the country, right?
Right.
So, can you talk about healthy poop and when a dog or cat owner should be concerned about their pet's poop?
Yeah, I totally get that. And actually, I'm really excited to be here talking about that because if you're talking poop, vomiting, diarrhea, anything like that, that is my bread and butter. That's what the whole life is focused on at this point. So I feel well within my wheelhouse. So, from an owner perspective, I usually like to emphasize that actually the bowel movements that our pets are having is really kind of a window into their health. We hear that all the time on different commercials and stuff. And it's kind of funny because I kind of try to empower and give agency to owners to investigate their animals' feces or poop, because if they do that, they can help me help them. So the big things you want to be watching for is frequency, change in consistency, change in color, or any of the kind of behaviors that go along with having a bowel movement, right? If my dog is straining or having any other difficulty, pain or whatnot associated with that, those are red flags that you're going to want to get evaluated by your veterinarian.
Wow. Oh, so, okay, another odd question. Why do some dogs eat like grass or goose poop? That's famous in our house. Like things that they shouldn't be eating, and I'll say, knock it off, and she'll stop. But is there a craving?
Yeah, I think there's a couple different things, and some of it is what you're saying. It's the love of the game, right? That's just what they like to do. There's some enticement to that, right? Like I have invested a lot of money in robotic litter cleaners at my house to try to quickly get rid of my cat's poop. Yeah. Yet my dogs are quicker than any AI technology that can be made to deal with that feces.
We call those sandy appetizers here.
Exactly. And especially with my St. Bernard and his jowls, I know he's done it because he wipes that litter down my my arm afterwards. It's a great. You are all welcome to come over for dinner sometime. But in reality, it's something that it may or may not be abnormal. So I try to chunk it into three big categories. Sometimes it's you just got lucky with this pet that has kind of a quirky behavior. The second category is when animals eat random things like what we would call pica. It can actually be related to abdominal disease, gastrointestinal disease being one of the most common. And then that third category is it actually can be a behavioral thing, like a soothing behavior for them, and it may be related to anxiety or something else that's going on in their environment. So
can I ask you, Adam?
Yeah.
I have the dog that's sitting right here is a golden retriever rescue. She was a mill dog, and I've got to get out there like you. As soon as she poops, I'm out there. 2 a.m. with an umbrella, whatever. But I was wondering, do you think she does that because she was confined in a puppy mill with puppies and she did that to clean up after the puppies? I'm wondering if that's almost behavioral with her.
I think it very well could be, right? Because actually, if we think of whelping in dogs that are giving birth, that's part of it. Like licking and ingesting placental matter and other things are fairly typical peri-birth or around that time behaviors. And I can definitely see a way that could actually be extrapolated out into just kind of something that they've adopted into a normal behavior.
Wow.
And on that note, you know, I know that owners read things like put hot sauce in. Are there things people shouldn't give their dog to make them stop eating poop? You know, you've read all these things, and I'm sure those can be harmful.
Wait a minute. People give the dog hot sauce, so it comes out in the poop and makes it unpalatable?
Or they put it on the poop.
Oh.
Anyway, would you
Yeah.
address that, Dr. Rudinsky?
Yeah, in general, why I go against that is because so many of these animals may actually be doing this for some sort of behavioral reason. You may actually, in particularly, like magnify that or worsen it indirectly by trying to correct it. So I typically try to use positive reinforcement, like, oh, I see you running towards the flock of geese and where they've been defecating. How about you come back and get this treat that doesn't make me want to vomit when you lick me?
Yes.
Instead.
Good thinking.
Good thinking.
Right.
Okay, so my family, it was at Christmas that the vet said to me, I think your dog has Giardia and you guys got to go home and do poop samples. It's not a holiday till your whole family has to give a poop sample, right? So I'm going to ask you, what is Giardia and can you get it from your dog or cat?
Yeah. So Giardia is probably one of the most common parasites that we're dealing with. It's kind of an interesting infection in dogs and cats because it can sometimes actually be a bystander and it can sometimes be an actual clinical problem. And in both scenarios, we are interested in whether it's there and how to clear it because, to your point, Janet, it actually can be something that's zoonotic. Like people can get Giardia. Luckily, we don't see that happen very commonly. So it's not something like if you're sitting on the couch, don't start side-eyeing your dog. It's okay that you have a very low risk there with proper like kind of hygiene and stuff at home.
Okay.
But it is something that carries that importance that we want to deal with for sure.
Okay.
Yes.
Go ahead, Al.
Yesterday, I had a client from Florida, a former client of mine. She also adopts rescue Goldens. And the dog has been having mucus in the stool and fresh blood. Okay, so they're seeing an internist there, and they increase the fiber. They can still go higher. And consequently, when that didn't totally help, they went to a hydrolyzed diet thinking it could be food allergy, and that was a disaster. Everything just came out like water.
Wait,
So
what's hydrolyzed? What's hydrolyzed?
they break down it's for food allergic dogs.
Oh, okay.
So anyway, they went back to the fiber, and so she was asking me about that. And I just wanted, you know, when you do see the dog's poop, for example, when you see fresh blood or mucus, what does that say to you, Dr. Adam?
Yeah, so that's really a good example of kind of what we were talking about way at the beginning, where as an owner, if you can come in and provide me data like that, descriptors of what the feces looks like, it helps me figure out what's going on and where. So a dog coming in with really mucusy poop and poop that is like waterier in nature or has like bright red blood or those sorts of things, all are indicative of a problem in the colon or that last part of the gut. And I'm going to manage it completely different. And in fact, like dogs with disease of that section of their gastrointestinal tract actually are much more fiber responsive. So it would really make sense why that fiber diet worked well for that golden and why a hydrolyzed diet, which tends to be a little lower in fiber, didn't work so well, even though it would work great for other types of cases.
So on that note, would you address canned pumpkin? Because I kind of heard that's passe now.
Canned pumpkin?
Yeah, it is for as long as Vet Med and canned pumpkin have been around, they've been in this like love affair together here. Yeah, just happily going. But it's interesting if you look at how much fiber an average animal would need to respond to like kind of a diarrhea cause. We have one study that characterizes that. Like if you were to give something like a Metamucil, right? And if I try to do that same thing with canned pumpkin, I'd have to give 3 or more cups of canned pumpkin to
Oh
get
my.
that same effect per meal. So it is just, unless you're putting your dog on a full canned pumpkin diet, which I don't
Yeah.
don't advise, right? You just can't do it. And that's the difference of like, we kind of think of canned pumpkin as, oh, holistically, it's this good source of fiber. But fiber in like your everyday diet as a healthy animal is different than the fiber you might need for management of fiber responsive disease.
So that's why people are all about this canned pumpkin because it's fiber. High fiber.
You'll see all kinds of things online like, oh, just feed your cat, dog or cat some canned pumpkin, or put green beans in their food. Any of the high fiber foods you or I would eat,
Huh.
but you just can't get the same effect with it. The
So
dogs love it.
they love it. Like it's
Yeah.
in some of the treats you buy. It says
Yeah.
pumpkin. Um, I was going to say, what's that coffee flavor? That's
Like pumpkin spice lattes.
pumpkin spice.
Yeah. Our fall PSLs. Yeah.
What about kaopectate? Because even though I'm a dermatologist, I still would get calls. Well, first of all, when someone would poop in the exam room of my office, people were so embarrassed. I mean, a dog or cat. Not- but
Well,
when
the
a pet
human
would-
too. You
right,
never.
oh, when a pet would poop, people got so embarrassed, and I'm like, oh no, I'm just glad it's normal. And I'm sure Adam, you feel the same way. Like to me, when I go to pick up their poop, they're sitting right here, and it's normal. It's a happy day. I'm
Oh,
happy
for
about
sure.
it. So
Yeah.
people should not be embarrassed when their dogs poop, because especially if it's normal, it's like cha-ching, cha-ching. That's a good thing.
Exactly.
But what about kaopectate? People would ask me about that.
Yeah,
For diarrhea.
and if I broaden that out, there's lots of things that we routinely think of, like statistically, everyone on this call has had diarrhea at some point. We don't escape it in life; no one does. But we often don't manage it except with your Imodiums or your kaopectates, Pepto-Bismol, those types of medications. And there is actually a place for those in veterinary medicine. The biggest reason why we often advise against it is mostly because it's hard in an animal to know whether you have kind of like, oh, just a bad Thursday diarrhea, or whether you have diarrhea that's signaling bad liver disease or kidney disease or something like that. So without knowing the cause, it's harder to like make recommendations with that, especially in contrast to things like fiber, which is going to be really safe across the board.
I love that fiber's in vogue. It just seems, and I mean, I'm not one of these. It seems natural. Like
Yeah.
it can't hurt.
Yeah.
Like someone giving Imodium to. Could you address that about how Imodium cannot be good in certain dogs
Yeah.
with a genetic
Oh.
problem?
Yeah, so like there's a few different things we can think of in terms of dogs that have sensitivity to the type of drug Imodium is. You can have overdose or side effects associated with that. And even if Imodium does what we expect, right? Imodium is going to slow the gut down. It's not going to move it along. But if I accidentally use that in, say, an infectious situation where I want to get rid of that infectious organism, I actually may be having the opposite effect of what I actually intended.
Yeah, you're trapping it.
Yeah.
Oh, good God.
Like a
And
sock
create
in there.
discomfort and all that.
Who wants to trap that? So, okay, we have two cats who are, we call them in and out, in again, out again, and they're killers. I'm going to be honest. So,
Yeah.
what are the dangers of that? And they don't really eat it, it's more like fun.
Yeah.
I
Like,
don't
hey,
need-
mom, look how good I did today.
Sport.
Yeah. So, it depends on a little bit on what they're eating, to be honest. Like, the catching is probably less of a concern, but you can actually get some infectious organisms that can come through from predation versus kind of like kind of inspected meat or something like you would get from
Right.
the grocery store and add to the food. So there are some risks with it. We don't honestly see a ton of that, but in general, cats that are out engaging in those behaviors do have a higher incidence of a lot of different infectious diseases. And if you, once again, provide that information, if your cat or dog is having a problem, that can be reflected in what kind of diagnostics and treatments you might use.
So, what if the cat kills the chipmunk, but then the dog eats the chipmunk?
Well, actually, I'm going to tell you just a quick story. My one colleague had this beautiful bloodhound, right? He was like the sweetest dog in the world. And he used to carry this toy around all the time. And they had let him out at the end of the night and
Oh, God.
went to bed, and her and her husband are in bed, and he like sets the toy down next to them, and she goes to throw it off the bed to get him to move, and realizes he had swapped his toy out for a dead squirrel
Yeah.
that he brought in from the yard.
Yeah.
And it was sitting on her pillow.
Yeah.
And I make her tell me that story like once a year, because it just warms my heart to hear about her resting her head next to this dead squirrel. But so once again, you have that same issue, right? Like,
Right.
because a lot of those, a lot of the risks or infectious risks that you have
Right.
could actually affect both cats and dogs alike. So if
Okay.
one's killing and one's eating, it is a potential risk for both of them.
So the cat kills it, our dog eats it, then the dog comes in and licks me.
Yeah,
Yeah.
exactly.
Right.
So
So
the
like,
whole
it's just
family.
going like right down the pike, right?
Correct. Yeah.
We actually had a live bunny, don't tell our friends, in the center of our dining room table with the cat lying there like, look at what I brought home. And the bunny is like going, literally,
Yeah,
I've never seen a
terrified.
nose move so fast. So I just have to tell you how I solved this. The problem is, rubber gloves protect you from everything. So I put on the Playtex rubber gloves, and I got the giant long barbecue tongs, don't tell
Yeah.
our friends. And I literally like opened the sliding glass door and went like this with the bunny. The cat went out. Everything was good. But I was pretty hysterical there for a few moments.
Yeah. Well, yeah. I mean, in particular, there's like cats are going to be cats, right? And you have a lot of that.
It's their job.
As a veterinarian who is a board-certified allergist and dermatologist, I've certainly seen my share of scratchy pets. Wouldn't it be great if we could stop the itch before it starts? Vetramax Allergy Season Soft Chews are an allergy defense supplement designed to do just that. This high-potency, clinically proven supplement boosts dogs' natural defenses against allergens and illnesses, and dogs love them. Allergy Season with Immunorise is a proprietary blend of probiotics, essential fatty acids, vitamin C, quercetin, and zinc. It's specifically formulated for dogs 20 pounds or more that are prone to itchy, irritated skin due to an allergic response. It's proudly manufactured in the USA with good manufacturing practices in an FDA-registered facility. Vetramax Allergy Season Soft Chews helps stop the itching before it starts and makes it better for you and your pet. Check out their products on VetramaxProducts.com or visit Chewy.com and save 50% on your first order by entering the promo code Allergy50 at checkout. Hey everyone, don't forget to pick up Country Critter Journal if you live in Northeast Ohio. It's a must-read for all pet lovers. Their goal is similar to ours here at the podcast, to educate the community on taking care of pets. They're advocates for adopting from shelters, not puppy mills, and they connect our local communities with goods, services, kennels, and those seeking to adopt a pet. They're a hometown paper with a personal touch. A must-read for all pet lovers, Country Critter Journal. You know, speaking of cats, I want to ask Adam a question about cats, but to add to that story, my friend who's a dermatologist in Dallas, Dr. Reed Garfield, I love Dallas stories because besides Aggies and that crazy business going on there, so he goes out to the garage to feed his dog, and he has the food in a plastic bin, which you're not supposed to do. Well, you can put it within the bag in the bin.
In the bin, right.
Yeah. So he opens it up, and he's looking over there, and he reaches in, and there's a possum in there.
No. This is Reed.
Yeah, it was Reed. Okay, but now, Adam, what about, is vomiting normal in cats? I know that's a big open-ended question, but when should an owner be concerned?
Yeah, so that's an open-ended question, but a really good one, because that is like, in my world, one of the biggest areas of misinformation. Because if you just get online and you look at tons of information out there for pet owners, it will say, normal vomiting this, normal vomiting that. And I always liken it to, like, imagine if we are having this podcast here and then I just vomited all over my keyboard. We wouldn't all just keep moving on with our day, right? That'd be a very, hopefully someone would be like, hey, Adam, are you okay, right?
Hairball.
I don't know. I might click off.
But so it's the same thing, right? And if you notice that your cat is vomiting once a week or even once a month, it is that's still an abnormal thing. Now, how severe it is might reflect how aggressively I go after it as a clinician, but it is still abnormal. It's not just a normal thing. And Alice, to your point, hairballs, one thing that's really interesting is if you look at like wild felids or cats in the wild, or even feral cats, you don't find hairballs in those colonies, right? That's something very unique to our domestic cats, and probably multifactorial in that manner. But once again, a signal that like we often treat it as like, oh, it's just my cat, and maybe it isn't a major problem, but it shouldn't also be looked at as a normal thing for them.
I wonder if those cats in the wild, their predators could find them. You see, if the vomit would be interesting.
Yeah.
Okay, so is it necessary to have fecal samples done every year when I take my dogs and cats in for their annual?
Good question.
Best practice, yeah.
Okay.
Especially if you have, there's two things that we get into. One, dogs are exposed to such a wide variety of things. And if we think of even the behaviors we were talking about before, what they're ingesting and what's on the ground, and it's always easier to treat something before it's a problem, right? So non-clinical parasitism is easier to treat than, oh, my dog won't eat and is having diarrhea all over my white rugs sort of thing. But also, the other thing we notice about cats, which a lot of them are living exclusively indoors, right? They can still get parasites just from our shoes going in and out of the house and other things like that. So no one's really quite immune to it. And we did an interesting study here that really showed, particularly in youth, there's a lot of benefit to that. Like that first half of the lifespan has a much higher incidence of getting those parasites. So if you did have to pick and choose, that might be an area where I'm going to focus on it more aggressively in my dogs when they're young, my cats when they're young, and then maybe pull back as they get older and put those resources towards other preventative health approaches.
So what is going on in the veterinary world, vet medicine world, with fecal transplant or implant transplants?
You'll hear it called FMT, you'll hear it fecal microbial transfer, transplant, etc. Essentially all talking about the same thing. I liken it to like a probiotic on steroids. It's the Arnold Schwarzenegger of probiotics, right? Cool. Now, because it is essentially taking feces, taking the bacteria and out of those feces. You're not really giving all the particulate associated with it as well. And then giving that back to the animal for the same benefits that the bacteria in our guts are under normal circumstance, right? Like we have this like really complicated ecosystem in our gastrointestinal tract, and we're reliant on it, heavily reliant on it. You can look at any like pop culture news source, news articles, they're constantly talking about that. And this is just another way to modulate that or affect it, or ways to treat animals that might have disruptions in it.
Wow, that's really cool.
So on that note, though, can you speak a little bit about probiotics?
Yeah.
And when an owner asks you, I deal more with food allergy, and people would say, well, I had them on a probiotic, and then, I'd see it was an over-the-counter one, and, it doesn't really, it's not monitored by the FDA, all that kind of thing. So what's your opinion on probiotics?
So you hit some of the biggest points. I think probiotics can be a really, really good tool in the toolbox. And we as pet owners like them, right? And we as veterinarians like them. The key with a probiotic is it isn't regulated in the same way as a drug. And we have studies documenting that some less reputable probiotics don't even have what they say they have in them, right? So it is a buyer beware, and your veterinarian's probably in the best position to counsel on individual needs, because that's the last piece of the puzzle with the probiotic is you need the specific probiotic for the specific purpose. It's not just kind of like what I found at the grocery store. I liken it to the example I use with clients is like, if you're buying me a a new puppy for my birthday, I'm going to be super excited. But if I'm thinking of a Saint Bernard, right, and you show up with a toy poodle, like those are two different types of dogs. I have both of them, so I'm not slamming either one of the breeds. But that's like, yes, they're all dogs. Yes, we all have probiotics,
right.
but if you want this one, that's a certain kind of
Right.
probiotic, and if you want that one, that's a different kind of probiotic, and you need to be careful. You can't just use whatever.
Interesting.
True.
Interesting. What questions do you have, Al?
Oh, well, I've got a couple. Toward the end of before I retired, we were seeing quite a few German Shepherds that very, very anxious and couldn't keep weight on.
Yeah.
And I don't know if that's poor breeding. My technician used to call them, they gotten real kind of stringy. And she's kind of right. They were pacing all the time and just very nervous. And I wonder if that's GI related, food related. Are you seeing that?
I am seeing that. And actually, we are now managing a ton of those dogs. That breed in particular has a high incidence of it, but we see it in almost every breed. But particularly kind of those high drive, high intelligence breeds are really prone to it. And what I think is going on with it is essentially like irritable bowel syndrome in people, or where you have kind of like behavioral health meets gut health.
Yep.
And if anyone gets nervous and has diarrhea, right? Big wedding day or other things like that, and you get an upset stomach from nerves, that is that connection between our brains and our gut. And it's there. And we see some of those dogs that develop these really big kind of behavioral disorders, and then it affects their gastrointestinal health, or vice versa. Their gastrointestinal health is intricately related back to their behavioral health.
So is that when you look at the microbiome then and maybe employ a probiotic or?
Yeah, so probiotics, a lot of our therapies are going to be similar. Once again, fiber. Our good old friend fiber is actually the dietary approach that's been shown to be most effective in those dogs. I actually always say German Shepherds are born fiber deficient, so get on it early. But most of our tools are the same, except the big difference with like inflammatory bowel disease, where there's inflammation in the gut, that's where you might use anti-inflammatories, steroids, and other medications like that. If I'm dealing with irritable bowel syndrome, I'm not using this. I don't need it, and I don't need the side effects that come with it, and I'll manage them differently.
Interesting.
Janet, the other thing is, and I'm guilty of this too, and I've got two Goldens fighting right here, and a husband who is not calling them off.
Attending to them, to the circuit. I can hear them.
Yeah. Anyway, Gidget has stress colitis. She's from China. She's a China rescue, and anything different, Janet will tell you when they come from Connecticut to visit, sometimes Gidget gets upset. So, of course, I throw a little metronidazole to her. And I know research tells me not to do that, but could you comment on that?
Well, yeah, I would love to comment on that. So some of that research is mine, so it's close to my heart.
I only give her one tablet for 2 days, literally.
Yeah. So
it's probably just placebo effect for me.
Well, and I think that's largely what it is.
Yes.
Right? So a couple points on that is, one, there is this fervor amongst veterinarians, clients, like where metronidazole is our holy grail.
Yes.
It's the shining down on us from above, right? And our studies have shown that, one, there's better methods, like dietary therapy actually works better than metronidazole. Fecal transplants works better than metronidazole.
I don't want to ruin my blender.
Yeah, exactly. But the other thing is metronidazole actually does injure the gut in and of itself. And other studies have shown that it doesn't really seem to do that much. Mm-hmm. So the biggest question you have to ask yourself when your dog, like Gidget, gets a upset stomach is, statistically speaking, that's going to resolve on its own most of the time.
Yeah.
And what I'm trying to do with treatments is swing that pendulum,
right?
Just to be a little bit shorter. And it actually appears that metronidazole, in the long run, worsens that effect.
Yeah,
And,
I've read your. That's true.
And
And as I'm
proving
giving it to her, I'm thinking that.
Yeah.
But I'm still giving it to her.
I
Well,
think you give her ginger ale and some saltines, and we're all good.
and yeah, exactly. Just yeah, put on the Sunday morning television. Let him eat the chicken noodle soup, and it'll be back on
fine.
track. But it's a very interesting thing because we're fighting something where like my whole early career we used that.
Absolutely.
It is such a benchmark, and
Yeah.
it's hard for our profession to change
Yeah.
because it's been rapid over the last 3-4 years that we've had this new data to show that what we thought was working wasn't actually working the way
Right.
we thought.
Right. How true. The other thing, and Janet, I know you've never heard of this, but could you comment about megacolon in cats?
Yeah.
I've actually had
That sounds
some
like a
viewers
giant
ask.
colon.
Yeah, it sounds like the end all be all of colons, right?
Yeah.
So, for the for anyone listening to this that maybe isn't so colon obsessed, the colon's that last part of the gastrointestinal tract. It has a large storage function. It's where the feces firms up. Cats in particular get a disease which we don't know actually a ton about. But what happens is it loses its function and dilates. So you get this kind of colon that used to be able to contract and push feces down so they can ultimately be defecated or have a bowel movement. And in this scenario, it just becomes flaccid or relaxed so much. And then these cats get severe constipation or what we call obstipation where they can't even defecate.
Wow.
And it's a pretty severe disease. Once again, it's something that we try to sound like a broken record here, but encourage owners to like keep track of what's going on with their cat's bowel movements
Yeah.
because the average person, right? If I told you your cat isn't going to defecate quite as often, if they're otherwise acting normal, that's like a hey, yes,
Great.
like
Yeah.
rest is
Let's
poop,
work
right?
for me.
Sure.
But the more we can intervene early in those cases, the more likely we can try to prevent, hopefully, the development of something like that.
Is that surgical?
It can be. We usually try medical management first, which would be
Yeah.
diet and laxatives and medications to try to make the colon work better. But in cases that become severe or require a lot of intervention and just aren't manageable like that anymore, there are surgical options that are considered more of a last resort.
Good luck getting that laxative in that cat.
And that's
I
the
know.
key,
Isn't
right?
that sad?
That's all I can think about as a cat owner. Like, if they have to prescribe something, I'm like, can you inject it?
Yeah.
Oh, for sure.
Yeah.
Yeah, and especially if you're like, if all of a sudden I'm telling you give these 3 medications 3 times a day, it's like, oh my God.
Yeah.
So sometimes we do have to go different routes, especially in our cats.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems. They make a food allergic diet that's an alligator-based called NP or a hydrolyzed salmon-based for dogs and cats called HF. So please ask your veterinarian about Blue Buffalo prescription diets. Does your pet suffer from brown tear staining on the skin under the eyes? We see this in any breed, but especially on the faces of those cute little white fluffy dogs. This tear staining can lead to a crusty, painful, difficult to remove discharge. Tris Opto Eye Wipes can help. These wipes contain Tris EDTA, which is effective against porphyrin and any invading bacteria that may accompany the porphyrin. For routine eye discharge prevention, ask your veterinarian about Tris Opto Eye Wipes. Let's keep those cute faces even cuter.
So tell us about your pets.
I will, because I'm never going to pass up on that question. But one more thing that just popped
yeah.
in my head with, AIs all over the place now, right? And some companies are developing litter box monitoring systems that owners can get, and it actually can identify which cat is going to the bathroom, and then your cell phone can be your tracking tool. And it'll just text you reports and those sorts of
Oh
things.
my gosh,
Imagine
imagine being
the poop. I've read about this.
Imagine being on a date. Oh, thank God she pooped.
Exactly.
And it's normal.
Most men would run like fire.
Exactly.
It's a crazy cat lady. But the ones that stayed are keepers.
That's the key right there. It's a litmus test, right?
That's right.
You know.
Or better yet, just a minute. I'll be right with you. I need to check my litter box.
That's a good one.
And we're golden.
Yeah. The poop is good. Yay.
I've read about this. I have read about
Yeah.
that. I am not. We have literally, because we have 2 cats. We used to have 3 or 4. We literally took a big Rubbermaid bin, like a blue bin, and made
Yeah.
a giant. We have 2 giant ones because then they like those.
Oh,
You know
yeah,
what I
they
mean?
do.
And the other, the cat doctor, Alice, was like, litter is key, right? Happy
Yeah.
litter, right?
Yeah.
So,
Yeah, but so I thought some people listening might love those because I think they're so fascinating, and it really just takes so much of that responsibility away from us.
Yes.
And
Yeah.
gives us the information we need, which is really nice.
can you imagine you're going to be getting all these emails from your clients, from your patients' litter box?
Exactly. Well, you know what? Honestly, if I were to pull up my email right now, what you'll see is like the 25 people that send me pictures of their animals' bowel
poop.
movements each day. I have one client who I fixed her dog's bowel movements like, I think probably 5-6 years ago now. She still sends me a weekly poop picture, and she puts her hand next to it for measurement purposes.
I love that.
and
See,
I don't
that's
have-
what I miss
Yeah.
being retired. I love that.
Poop
Exactly.
pictures.
She's like one of my favorites. She's like the sweetest owner, and just she is reporting. And
I
like
love
it.
that.
Well, once I think it was the cat or the dog, there was like a giant worm in it, and I call Alice, and she goes, "You have to pick that up, and you have to take that to the vet." And I'm like, so I put it in this like
Oh, wait, the
triple
rubber gloves. You got to do
rubber
the
gloves,
latex.
triple Ziploc, and then I take it to the veterinarian, and the assistant goes, "Okay," and I'm like, "Aren't you gonna like look at get excited? There's a big worm in there," and she was like,
She's eating her sandwich while she's looking at that. This is veterinary medicine.
"I
It
wanted
is.
her to bow, because I had put it in that."
No.
Triple
Yeah, this feat that you've accomplished. with
Yes.
it. Yeah. You can edit this out if you don't want this story
Okay,
in
go.
here. But
the more poop, the better.
I had when we first started doing fecal transplants, right? Like now, one of my colleagues here at OSU is chair of our fecal bank group, and now we have like a product that we use as well as the commercially available. But in the infancy of this, we used to use other household animals, right? So we would say, if like Alice, you have 2 Goldens, and one would have healthy poop and the other one wouldn't, and we would sometimes try those. And this owner brings in the poop for us to process, and she hands me the bag, and it's a bag of diarrhea. And I was like, oh, well, I'm not going to be able to use this. This is, is your other dog now having diarrhea as well? And we need to rethink. And then she goes, no, that's mine. I couldn't get the dogs to go. And she says that to me while I'm holding the Ziploc bag.
Oh my god. Oh my god. Oh my god.
And I was just,
Question is, how did she get it in that bag?
Yes.
I'm just saying.
Janet, you had to take your poop sample, and I don't even want to picture how you did that. I can't imagine.
This is funny because my Pilates teacher had
Wait,
some.
it's like the astronauts when they poop in the bag.
yeah.
Well, it was my Pilates teacher. She had gut issues, and we start talking about it. And she goes, "Did they hand you the paper French fry container?" And I went, "I will never look at French fries again, because they give you. It's like a little dish this big, and I'm like, what am I gonna aim?"
Wait till you have a kidney stone and you have to pee in the hat. The hat. I'm like,
Well, when I
there
had
it is.
the
There's
poop
the hat.
samples from the 5-year-old and the 7-year-old,
Yeah.
we had to go to the pediatrician and get the kit and all this stuff, and the pediatrician's laughing her ass off, and she goes, "Here's the trick: you put Saran wrap
Oh,
over
yeah.
the toilet."
That's a trick, too. You do that in college.
Well, yeah, or to get the kid to poop on the Saran wrap, and I was like, "Oh my god!" It was
Yeah. Wow. All these
staring at
little
the mom.
tidbits.
Yeah.
Little tidbit. So wait, let's get back. Let's get out of the
Okay, but
garbage,
wait,
out of the
I
toilet.
want to ask Adam. I'm obsessed with these blenders with the poop in it. How do you sterilize those?
Well, now we do it very differently than in the time. It would be like washed and autoclaved. It's
Oh,
typical,
autoclave.
like,
Okay.
lab processing.
Okay.
Now everything is processed through like more of like benchtop research techniques.
Okay.
So it's disposables, and then everything's banked and sterilely handled.
So do
So
you
getting
prefer
my Janet.
Hamilton Beach or do you prefer like
No, it's, autoclave's different. But wait, getting
No,
back to
that's-
the diarrhea in the bag. So, how did you explain to her? Okay, but
like
it
why
had to
did
be-
she bring her own
Had to be
poop?
dog poop. That's
Yeah.
what I'm saying.
Well, there's so many. Like, I feel like I could hire a psychology PhD student to investigate what happened in this
The
scenario.
brain gut access.
Exactly. But yeah, we just talked about it, and I said, okay, well, I also can't do that, and I don't have authorization to use any
He's so
human
sweet.
products, and yeah,
Instead
And
of
just
like,
kind of-
what are you thinking?
yeah. So I don't want you to take any offense, but I'm going to throw your feces in the garbage can now, and yeah.
You didn't blend that one up.
Yeah.
So okay, back to like out of the pooper. Let's talk about your pets.
Yeah, I want to
Oh,
hear
yeah.
about Adam's pets.
Well, I've got 7 in my house, and then I've got some chickens and some koi out of my house.
Oh, cool.
But the 7 in my house, I have 4 dogs and 3 cats.
Okay.
So I've got a Saint Bernard, a Gordon Setter, an Irish Setter, and a toy poodle.
I know who you got the Gordon from. I bet I know.
Mary.
Yes.
Yeah. I walked it. She's a surgeon at our hospital.
Dr. Mary McLaughlin,
And
yeah.
just so wonderful.
Oh,
and I
love
walk
her.
in to get a surgery consult with her one day, and she's like, "Do you want this puppy?"
Oh.
And I was like, I'm an adult. I can't be making rash decisions. I was like, "Thank you, Mary, but no." 15 minutes later, I walked back in, and I was like, "I'll take it. Don't worry. We're
What
good."
did you name the Gordon?
His name's Ivan.
Oh.
Yeah. So, and then I've got my 3 cats. They're all rescue brachycephalics, the ones with the flat face.
Yeah.
So I'm constantly cleaning eyes and nose with all their
I bet
respiratory
you are.
problems. But
Is that like a breed of cat?
brachycephalic is like pugs, bulldogs. It's the ones with like the
Fat,
shorter
flat.
skulls.
Yeah.
But the dogs people know more. But with cat breeds, mine are an exotic short hair, a Persian, and a Himalayan, which are all very closely related.
Yeah.
But
Wow, they're fancy.
Speaking of that and flat face, there's a lot of promotion, and not by vets that I know of, but of the people that make them, of raised bowls for cats.
Mm-hmm.
Do you notice, does that help with GI issues, or is that just a fallacy?
Yeah, there's a little data in dogs that helps with certain situations, but then contradicting information came out. So I usually kind of more tell people, you kind of figure out for your pet what works best for them, but it's more of a
Okay.
trial and error rather than like a prescriptive directive that I give, if that makes sense.
Yeah, yeah.
You can see the cat going, could you bring that in a pedestal dish?
Exactly.
right now.
Gold plated,
Like
please.
this, standing up like right now.
Like in the commercial where the Persian cat's eating out of the Waterford crystal.
Exactly.
Makeup.
That's what I'm saying. Ours are it's a metal bowl on a tray because they're kind of messy, you know?
Yeah.
But you know, when I think of it, I have a 21-year-old cat, Capri, and
Yeah.
she's in renal failure, and so all the food I can get into her in liquid, I'm happy to
Oh,
do.
yeah.
I think I wash her bowls more than I wash my own. I'm always
You should
washing
give her a
Capri's
little
bowl.
bit a lot. You know what I'm
Yeah.
saying? Like all day long, you're giving her stuff.
I'm a servant. I'm her servant.
Exactly.
I know because
And
she
with-
goes, yeah.
Yeah, cats love a clean plate too, right? Like, my dogs will eat off the floor or the ground.
Oh yeah.
And cats are like, no, I'm going to need this very specifically.
And
done."
cats love when you wait on them.
So Dr. Rudinsky, what is the most rewarding thing about your profession?
Oh, it has changed over my career.
The once
I
a
think-
week poop report.
Yeah, exactly.
The diarrhea bag.
Settled on fecal pictures with hands next to it. No. I actually think I have one of the best jobs in the world because I've got a lot of the different aspects that have helped me over the years, which is like, I feel like I can contribute through my research, I can contribute through teaching, and I can contribute through actually seeing patients.
Mm-hmm.
But I think most veterinarians would agree it's coming to a place where you see more animals than people. That's,
Oh.
we love the people side of it, but
Absolutely.
you can't beat a workplace where you're mostly surrounded by dogs and cats. Like,
Yeah.
Yeah, that's true.
And
what
you
do I
know,
have to complain?
you kind of sometimes get annoying things like I was examining a cat and I was flea combing it for Clitella mites because we had a
Yeah.
big infestation of Clitella in Cleveland years ago. And as I'm combing and the cat is on the exam table and talking to the owner, and she said to me, "Yeah, but his problem is he's sneezing." And those mites can crawl into and out of the nose, and I'm thinking, would you just let me do my job?
Yeah.
You know what I
You
mean?
don't
And
know that stuff.
I know you
Yeah.
don't, and I explained that. But to Adam's point, if I had the cat back in the treatment room, I could be doing this lickety split
Yeah,
real
yeah.
fast.
Yeah.
And not, and I love explaining. I mean, education
Right.
is a part of all what we do every day, but it just sometimes it gets to you.
Yeah. Well, you know, the payoff for any of that is, I think, probably, you know, whether it's that story I told you about the feces or the picture with the, you know, like, it's just, you know, what we have in common, whether you're in the industry or not, or just a pet, we are all obsessed with our animals, right?
Yeah.
And because of that, we are all neurotic lunatics.
And
the
anxious to
things-
talk about our pets.
Yeah. And the things
Like, don't
we
ask
do
Rusty
are
about his
so
pets.
Weird.
Yeah.
So the stories are endless. It's phenomenal.
Yeah.
And
it
I
really-
encourage it. Bring on your weirdness, right?
Oh yeah, and every vet can write a book.
Yeah.
Every vet. And I would love to read every one of them because
Yeah.
it's like it's a fun book.
Exactly.
Yeah.
So, Dr. Rudinsky, here's our question.
Okay.
What is your pet or human peeve?
Pet or
Other than the
human?
person bringing the bag of their human diarrhea.
Yeah.
That's off the table.
Oh,
That was
my
weird.
I think
goodness.
that was a cute story.
You know what would be really good is if I gave you a nice political answer and then you tiled that against all my residents and students being like, here's all of his grievances.
Yeah.
I'd have to, the thing that I get the most flack for animal wise is I'm not a kitten person. Like, I adopt all old cats. I love old cats.
Me too.
I would take 500 geriatric cats.
Yes.
I feel like they're the sweetest, most wonderful things.
Yes.
I've fostered some kittens, but
Yeah.
like, you know, when everyone goes into like the cat ward, everyone's like rushing to the kittens, and they're like, Adam, like, what's wrong with you? And I'm over there with like this like 2-pound calico that's, you know, 25 years old sort of thing. But
Yeah.
that's where my heart is.
Yeah.
So not quite a pet peeve, but it's definitely something that I get made fun of a lot for.
See, now twice we've had kittens, sibling kittens, because Dr. Alice said, you got to get two together.
Yeah.
And I have to say, it is 2 tons of fun. It
Yeah,
is. It's a
exactly.
lot of fun. But it's different cats and kittens. Now, our 2 cats are siblings, boy and a girl. The boy will not even come near me. Like,
Oh,
I
yeah?
move too fast for him, but the girl will. But the boy cat will go to my husband, our sons, and snuggle up, and me, nothing.
Yeah.
So we can't figure that out. It's weird.
Yeah, and some of them are like that. You know, you never know what you're gonna get.
Adam, do all of your cats get along with the dogs?
Yeah.
Okay.
Wow.
So, yeah, that's what part of the reason, honestly, because I get like either sick or older cats
Yeah.
is all I adopt. I end up usually getting younger. Not all of mine. A lot of mine were adopted, but my dogs are usually puppies, so I can condition them. They're not going to stress the cats or anything like that.
Well, we haven't had a pet peeve being kittens before.
Yeah, yeah. I'm going to get canceled for that. I'm sure.
Well, this has been great. Wow, thank you for all the information. I've enjoyed
This has been so much fun. I can't.
More
Yeah,
so
I had a good time.
Yeah.
It's really been something. Thank you.
Hey, listen, we can't thank Dr. Adam Rudinsky enough. We got Janet. We got to have him on again because we want to hear more about the fecal transplants.
I want to hear more about poop. I'm digging it.
So we're going to call it a day, and I apologize for my 2 Goldens wrestling, as OJ used to say, underneath my chair here. But anyway, this is Dr. Alice Novotny-Jeroman, one of the Novotny sisters, and
Janet Novotny King from Cleveland, Ohio, saying thanks for listening. Don't forget to like us and follow us. And thank you, Dr. Rudinsky, for joining us. OHIO.
Yeah, I'll be back anytime. It was wonderful.
yay!
Thank you. Thank you.
Thanks. Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts, because we love to have those likes. Thanks so much for listening.
That's actually really good. You could both go bye-bye.
Bye-bye.
You know? Yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And this month only, take advantage of this special offer. You can get 50% off Vetramax Allergy Season shoes through Chewy.com. Enter promo code Allergy50 at checkout. Vetramax Allergy Season. Start it before it starts. Place your order now for this 50% off deal. Go to Chewy.com and enter the promo code Allergy50. Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.